Here are some home remedies that may provide relief. 1. Stay hydrated. Drinking an ample amount of water is crucial in flushing out the kidneys and diluting the urine, which can help prevent the formation of kidney stones and assist in their natural passage. Aim to drink at least 8 to 10 glasses of water per day, or more if recommended by your doctor. 2. Lemon juice. The citric acid present in lemons may help prevent the formation of certain types of kidney stones. Squeeze fresh lemon juice into a glass of water and drink it regularly. This can increase urine citrate levels, which may inhibit stone formation. 3. Apple cider vinegar. Some people claim that apple cider vinegar can help dissolve kidney stones or ease their passage. Mix 1 to 2 tablespoons of apple cider vinegar with water and consume it. However, there is limited scientific evidence to support this claim, and excessive consumption of apple cider vinegar can be harmful, so consult with your healthcare professional before using it. 4. Dietary adjustments. Depending on the type of kidney stone, certain dietary modifications may be recommended. For example, reducing sodium intake, limiting oxalate-rich foods, such as spinach, rhubarb, and chocolate, moderating protein consumption, and avoiding excessive vitamin C supplementation, which can increase oxalate levels, may be beneficial. However, it's essential to consult with a healthcare professional or a registered dietitian to determine the most appropriate dietary changes for your specific situation. 5. Herbal remedies. Some herbs, such as basil, dandelion root, and nettle leaf, have been traditionally used to support kidney health and may have diuretic properties. However, scientific evidence on their effectiveness in treating kidney stones is limited. Consult with your healthcare professional before using any herbal remedies, especially if you have underlying health conditions or are taking medications. Remember, these home remedies should be used as complementary approaches and should not replace medical treatment. If you suspect you have kidney stones or are experiencing severe pain, urinary symptoms, or complications, seek immediate medical attention. A healthcare professional can provide an accurate diagnosis and guide you through appropriate treatment options based on the size, location, and composition of the stones. Thanks for watching.